Childbirth is seen as being a happy and wonderful time in a woman's life, but sometimes this isn't the reality. It can be stressful and confusing, whether she's a first-time mum or already has children. It's also a time when women are vulnerable to mental illness, even if they've previously been healthy. If a woman or close family member has previously suffered from a serious mental illness, such as severe depression or bipolar disorder, her chances of developing a mental illness at this time are higher. Although most women go through pregnancy in the first year after giving birth without any mental health problems, mental illness can affect anyone at any time. It's not a sign of weakness or failure. It can have a profound impact on the woman, her baby and family, so it's important that it's detected and treated as early as possible. In some cases, it can prevent serious illness. Most illnesses are mild and can be managed by the woman's GP. Others, such as severe postnatal depression, anxiety disorders and postpartum psychosis, require help from the specialist perinatal team. Our perinatal service provides support, treatment and advice to women who develop a serious mental illness in pregnancy and during the first year following childbirth. We also offer preconception counselling and support to women who have previously suffered from a serious mental illness. Our specialist perinatal nurses see patients in their homes. We aim to be non-judgmental and to empower patients, treating them with dignity and respect. We assess and support women with moderate to severe mental illness and their families, up to a year after childbirth.
Before I discovered the services, I was in a bit of a dark place. Me and Nick had been trying to have a baby for a long time and fell pregnant with Henry, and it all came as a bit of a surprise. We weren't expecting it. We were fine through the pregnancy and then had Henry, fine through the birth, and then 5 days in, everything hit me like a train. I couldn't look at Henry, I couldn't even think of him. I had to sort of get him out of my mind, out of the way. I was suffering severely with panic attacks and anxiety and depression. My family didn't know what to do. It was a terrifying time, I think, for all of us. I felt completely helpless and hopeless and never saw that it was ever going to get any better. Was terrified that I'd lost a connection with Henry because of it. It's horrible. It sounds awful to say it now because it sounds so dramatic, but at the time, if I could have found a way out, I would have taken it. The difference between me prior to seeing the perinatal nurse and after, I've got my life back. I no longer feel like I'm alone in this, like I'm the only person that's ever had postnatal depression. I would say to anybody else that's maybe sat at home feeling alone, depressed, anxious, panicky, and they don't know who to speak to, or they don't want to admit that to their family or their friends, I would advise them to open up, talk to somebody, see your GP, speak to them if you don't want to speak to a close friend or family member, but make the start in making a change to your life.
Since she's been seeing the perinatal services, things have been completely different. She's got something to focus on. She goes, sees them every week. She knows that if she ever feels down, she can just pick up the phone and make a phone call and things can get better from there. I feel like I've been involved in the process with Maurice coming in to visit me as well as to visit Lucy, and I've personally learnt how to deal with things as well myself. So when Lucy goes into an episode, we have a plan, we have a process that we go through together, and that's something that we've learnt from this process.
The perinatal service accepts referrals from GPs, midwives, obstetricians and health visitors. We encourage women to talk to these professionals openly about their problems, and this is the first step towards seeking help. Once referred to the team, referrals are discussed at the weekly team meeting. Depending on what the woman's needs are, it's here that a decision is made about the best option for her treatment. The perinatal team is made up of a consultant psychiatrist, community psychiatric nurses and psychiatric trainees. The team is highly skilled and experienced in dealing with all aspects of managing pregnancy-related and postnatal mental illness. We see women from Leicester, Leicestershire and Rutland. Leicester has a high proportion of women from ethnic minorities and the service is sensitive to their diverse needs. Outpatient clinics are held by the consultant psychiatrist and medical team at the Bradgate Mental Health Unit. If medication is required, the risks and benefits are discussed with our patients and they're actively involved in making the safest choices. Rarely, very severely ill women may need admission to a specialist mother and baby unit, and we facilitate this to the units in Nottingham and Derby.
Any type of mental illness can occur in pregnancy and following childbirth, and it's really important that they are identified and treated early so that potential consequences for the mother and the baby are minimized. Now, depression and anxiety are the commonest and occur in 15 to 20% of women. However, postpartum psychosis is a severe and catastrophic form of mental illness. It occurs after 1 in 500 births, usually within 48 hours of delivery, and requires prompt admission to hospital, preferably to a mother and baby unit. It's commonest in patients with bipolar disorder, but can also occur in women without a previous history of mental illness.
It was about 4 days after Catherine that I became unwell. I didn't pick it up that much, mainly my family noticed that I wasn't acting, I wasn't myself. They picked it up and we went to the doctors. It took a few visits to the doctors for them to recognise exactly what it was. But once they did, they got in touch with the crisis team and they came and helped. I was admitted to hospital and I was diagnosed with postpartum psychosis. I found that it was a very scary time because we didn't know anything about it. My family didn't know anything about it and neither did we. And we didn't know how long it was going to last. But as soon as the medication started to work, it was a lot better. They explained that it's a short-term illness and that I would become better with my medication. So once I was taking my meds, I felt a lot better and I was released after about 10 days. So I was discharged out of hospital and the perinatal team came to see me. I got involved with a perinatal nurse who would come out to my home and visit me at home, which was really nice. We would talk about how I felt and my recovery, and I thought that was very important because they could understand, they knew more about it, didn't have to look it up in a dictionary what it was, and they reassured me a lot and helped me to move on. Once me and my husband decided we were going to have try for another baby, we contacted Dr. Lazarus and went in for a preconception appointment, and we spoke about coming off my medication and then trying for a family, and then what would happen with next time round, putting together a care plan and maybe going back on my medication later on in my later days of pregnancy. And that made me feel a lot better because it was very reassuring that it wouldn't be as a bad experience as it was the first time round. I feel much more confident this time round with having the care plan in place. I feel that if I was to become ill, we know what is going to happen. So I feel a lot better this time round, a lot calmer, reassured, and I can relax and enjoy it, hopefully.
The perinatal team has established good links with local maternity hospitals. We work closely with our specialist mental health midwife, consultant and maternity staff providing advice and training. We also talk to other health professionals to recognise and treat mental illness promptly. We offer a wide range of treatments that are tailored to individual needs. We run support groups for women with mental illness. We link closely with other professionals and agencies involved in the women's care, having joint care plans and integrated pathways ensuring continuity of care in the pre- and postnatal period. Women are also seen on the maternity wards after delivery if needed. Mental illness in pregnancy and following childbirth is often predictable. Even severe mental illnesses respond well to treatment. The perinatal service helps women work towards recovery at this difficult time in their lives. We provide care and support, giving information and reassurance until they feel able to enjoy life and motherhood again.